Hello everyone. Now let's talk about lymphangitis. And this lymphangitis or acute lymphangitis can be asked as a 2-marker question in our university examinations. And I have taken my points from SRB. So let's see what all you should write if lymphangitis is asked for a 2-marker. What is lymphangitis? It is an acute non-suppurative infection. Acute non-suppurative infection and spreading infection of lymphatics of skin and subcutaneous tissue. It is an acute non-suppurative infection. It is an acute non-suppurative infection. First point. Second, it is a spreading infection of lymphatics of skin and subcutaneous tissue. Acute non-suppurative infection. It is a spreading infection of lymphatics of skin and subcutaneous tissue. Third point, it is due to beta hemolytic streptococci, staphylococci, clostridial organisms. So, it is an acute non-suppurative infection. It is a spreading type of infection of lymphatics of skin and subcutaneous tissue, and it is due to beta hemolytic streptococci, staphylococci, and clostridial organism. And it is also commonly associated with cellulitis. So, these are the 4 points in the introduction section. It is an acute non-suppurative infection. It is a spreading infection of the lymphatics of skin and subcutaneous tissue, and it is due to beta hemolytic streptococci, staphylococci, clostridial organisms, and it is commonly associated with cellulitis. Next points, in endemic areas, that is in the coastal areas of India and all, filariasis is the most common cause. In the coastal areas, in the endemic areas, filariasis is the most common cause. Filariasis is caused by Wuchereria bancrofti, we know, and it is through the bite of Culex mosquito. In endemic areas, in the coastal areas of India and other continents, filariasis is the most common cause, and it is caused by Wuchereria bancrofti through the bite of Culex mosquito. And in Wuchereria bancrofti, in filariasis, the microfilaria, after the bite of Culex mosquito, the microfilaria will reach the lymph nodes and will form the adult worm in the lymph node, and it will block the lymph node, causing obstruction and then fibrosis, and then followed by lymphangitis. So that is the pathogenesis. So what is lymphangitis? We know it is an acute non-suppurative infection, spreading type of infection of the lymphatics of skin and subcutaneous tissue, and it is due to beta hemolytic streptococci, staphylococci, clostridial organisms, commonly associated with cellulitis. And in endemic areas, filariasis is the most common cause. And how filariasis is causing lymphangitis, we have mentioned. Wuchereria bancrofti is the organism. It is passing through the bite of Culex mosquito. Microfilaria will be reaching the lymph node, and the adult worm will be forming, and it will be blocking the lymph node and will cause obstruction, and then fibrosis and lymphangitis will be developed. Now let's see what are the clinical features. First one is streaky spreading redness, that you can see in this picture. Streaky spreading redness on the right side lower limb, and the left side upper limb you can see. Streaky redness you can see there. So that is the first main important clinical feature. And on pressure the area will be blanching, and on release of the pressure the redness will reappear. That is a characteristic finding in lymphangitis. Streaky spreading redness will be there. While applying the pressure the area will blanch, and while releasing the redness will reappear. And there will be edema of the part, and palpable tender regional lymph nodes will be present. Edema will be there, and palpable tender regional lymph nodes will be there. And fever, tachycardia, and other features of the toxemia will be present. And growing lymph nodes will be enlarged and tender in the lower limb lymphangitis. So these are the clinical features of lymphangitis. The main thing that you have to mention is streaky spreading redness, that you can see from the picture. Like this it will be appearing. So streaky spreading redness will be there, and on pressure the area will blanch, and while releasing the redness will appear, and edema of the part will be there, and the regional lymph nodes will be palpable and tender. Fever, tachycardia, and other features of the toxemia will be present, and the growing lymph nodes will be enlarged if it is in the lower limb lymphangitis. If it is in the upper limb lymphangitis, the axillary lymph nodes and other lymph nodes in the hand, palm, those will be enlarged. What are the investigations? Blood count, platelet count, renal function test and liver function test, and peripheral smear and blood culture. So blood count and all, to understand what is the blood count, and culture also we can do blood culture, because to identify the organism, what organism is causing and all. Peripheral smear is for the Wuchereria bancrofti and other infections, and platelet count whether it is normal or not, and RFT, LFT whether the patient is in toxemia or other conditions and all. It will require critical care and all. Coming to the management part, we need to give antibiotics, and the preferred antibiotics are penicillin and cloxacillin. So antibiotics, penicillin, cloxacillin. Elevation of the lymph should be done. Rest is necessary, and glyceryl magnesium sulfate dressing is given. So antibiotic. Which antibiotics? Penicillin or cloxacillin. Elevation, rest, glycerin magnesium sulfate, GMS, glycerin magnesium sulfate dressing. And the management of septicemia toxemia is done with critical care. If septicemia toxemia is there in the investigation, if we found any septicemia toxemia, we have to manage this patient with critical care. So this is the management schedule, and once again I'm showing the pictures. The left side you can see the upper limb, and the right side you can see the lower limb. Here blanching you can see on the typical redness will be there. While we pressing the redness, the blanching will occur, and once we remove our hand, the redness will reappear. So that is a characteristic finding in lymphangitis. So I think this much is enough for writing 2 markers. So if lymphangitis or acute lymphangitis is asked as a very short question, you have to write what is it, how is it causing, and then clinical features. Important clinical features: streaky spreading redness is very important, and edema, fever, tachycardia. Investigations: the basic investigation that we will do for all the conditions: blood count, platelet count, RFT, LFT, peripheral smear, blood culture, etc. Management is antibiotics, penicillin, cloxacillin, and elevation of the lymph, and rest, glycerin magnesium sulfate dressing is given. And if it is septicemia toxemia, we have to manage with critical care. And that's it for lymphangitis. Thank you guys. Have a nice day.